You mentioned earlier the use of data really helps your team sell, so to speak, the business value of really doing quality improvement and putting infection control at top of mind. So can you tell me how did your facility arrive to that? How does leadership just well buys into it? How is quality really important to them? Because they have other priorities. Of course, they want to make sure they save money, they have enough money to sustain operations. How did your team achieve this?
Yeah, I mean, again, it comes down to our institution
Mm,
culture. I mean, people cannot argue with hard facts, especially when it
yeah,
comes to finance or it comes to like units of measure or
yeah,
productivity index or things like that. Like, no matter how much you don't want to deal with finances in
yeah,
infection prevention, it's like, well, yeah, we had 10 CLABSIs, and it's not just the infection that you're paying for, it's the drug regimen, it's the risk
yeah.
to C. diff. And again, it's using hard numbers and hard data and literature to make your point. And when
Mm,
you put that in front of people, and you put it in front of leadership, it's really hard for them to ignore that.
mm-hmm.
I mean, I
Yeah,
don't know what else to say, Carol. I mean, it's
yeah,
just like you
yeah,
can't argue hard facts. And if
yes.
you can demonstrate that, then, it really should go your way. And if not, then I don't know if that's an organization I would want to be a part of.
Yeah,
And it's not like they
yeah,
come back. I mean, it's not like, okay, great, you get all this stuff. I mean, there's a
yeah,
lot of negotiation and a lot of persistence and a lot of spinning things in different ways with the
yeah,
same data, trying to get your point across, I
yeah.
guess. Yeah.
And I think it's very important the fact that you emphasize the infection control team must be creative, innovative, have very good listening skills, and know
Yeah.
how to sell your point. So those are 4 points that I'm really taking out of all this. Yeah.
Yeah.
So
I mean, you
that's
have to, yeah.
yeah.
But also being collaborative, right? So selling my points, like
Yes.
say, like for instance, I'm going to a unit that has a high CLABSI rate. And I'm like, well, here's the data. This is where you were a couple years ago. You
Yeah.
improved, you got worse, or maybe you were always bad and we're just now coming to you. It's like, here are some things that I saw on some of these reviews, right? Like,
Mhm.
oh, you have a high number of blood culture, you have a high rate of blood culture contamination on this unit. And probably 50% of these were related to the contamination of the blood culture, not necessarily like a true CLABSI. And
Yeah.
everyone goes, oh my gosh, well, we got to do something with blood cultures. You're like, "Yeah, that sounds like a great idea. Why don't we do some education around blood cultures?
Yeah.
Or why don't we do a partner blood culture, you
Mm.
know, together? Make sure that, you have a buddy system and they come up with the ideas and you kind of just
Yeah.
guide them to where you kind of want them to go.
Yeah.
Or it's
Yeah.
like, no one's getting a CHG bath. Well, why is no one getting a CHG bath? Oh, when we transferred over to the electronic medical records, that order didn't come with everybody. What?
Right.
Oh, okay. And then now you have a system problem that you could fix.
Yes. Yes. Yeah.
But it takes the collaboration of the bedside, both physicians and nurses, for you to even understand what is happening. Because we can see it within our infection control lens, but a lot of time those collaborations and their ideas spark something else that you may never have understood, you
Right.
know?
Right. Right.
So presenting the data, getting them enthused about it and being like, yeah, this is a problem because no one wants to do harm. I doubt
Yeah.
there's anyone in healthcare that's like, yep, I'm going to go do harm
And
today
hurt
on my
someone.
patient. Right.
Yeah.
Like, I'm going to
Exactly.
do
Yeah.
this.
Yeah.
We all want to do the right thing. And when people actually see their data, when they see what the problem is, and you can tie that to a patient specifically, this was Vanessa Makarewicz last week or a month ago. Remember how annoying that patient was, Vanessa, and you're like, oh
Yeah.
yeah, oh
Yeah.
yeah, she was licking her catheter, she was doing and you get that
Yeah.
feedback, then you go,
Yeah.
okay, how can we put in processes to not have this happen again?
Yeah. Yeah.
And the most important thing is sometimes these interventions work and sometimes they don't.
Mm.
But the ones
Great
that
points.
you, yeah, and it's okay. And it's okay
Yes.
to fail. It's okay not to
Yep.
be perfect.
Yep.
But even when something fails, you learn from it. Like, okay, well, that didn't work so much, last time. Maybe let's look at another view of this, or how can we look
Yep.
at this problem in a different way,
Yeah.
you know?
Yeah.
So,
And do you have an example without going into the confidential details, of course? Do you have an example of a QI project that was successful that you were able to sustain until today, or sustain the results until today?
well, it's really hard to say what has been sustained because the sustainment is the hardest part. Identifying, rolling out a QI project, getting the data
Mm,
is actually quite easy. Sustaining that success is extremely hard.
yeah.
And the way that I like to think about it in my mind, and I think you probably have heard this many times from me, is that quality improvement, especially infection control initiatives, you have to always have the pot simmering. So, say you do really
Mm,
well in CLABSI. You can't just turn the pot off and let it get cold. You have to keep
right.
that water simmering
Yeah.
somehow. And in the, you know, 15 years or so that I've been in infection control, that has been really hard. We can see when it's coming, you're like, oh, oh, the water
Yeah.
levels are a little low. Like, let's
Yeah.
turn the heat up a little bit. Because sometimes just visibility gets that sustainability back.
Yeah.
I will say that COVID has been a huge disruptor. So a
Mm,
lot
yes.
of the gains that we had done pre-pandemic have been, again, totally wiped away. And what we're doing now is, again, rebuilding. And
Mm,
so, and we're rebuilding in different lights. Our brains are thinking about things differently. So it's not like we're just going back to what we were doing before. So with the exodus of all of these healthcare workers, our depth of knowledge has gone away.
has shifted to, yeah.
So we're starting almost fresh again with things that we knew how to do really well in 2019 that
Yeah.
we may not
Yeah.
know right now.
Yeah.
So call me in 3 years or so,
Okay.
and I'll let you know how blood culture
So we can do
contamination
this
is
again.
going. Yeah, yeah, and we can sustain it, and you can be like,
Right.
oh yeah, this has worked really well. But
Yeah.
again, I think my advice to that answer is really the water has to simmer always. You cannot turn it down. You can turn it up, but you can't turn it down. It has to be
Yeah.
at this nice slow boil all the time, and it's
All the
hard.
time. Yeah.
It's hard because there's so many competing priorities. It's not just infection prevention, it's DVT prophylaxis, it's pressure ulcer injury, it's fall
Yeah.
prevention. There's so many other quality metrics out there that need to be, addressed. So,
Yes.